Welcome to Podocyte Talk. In today's episode, we explore 3 new studies offering fresh insights into managing kidney diseases. We'll discuss how obesity influences polycystic kidney disease progression, the role of albuminuria in predicting outcomes for IgA nephropathy, and how early identification of tacrolimus metabolism speed can help optimize kidney transplant success. The first study takes a close look at patients with autosomal dominant polycystic kidney disease, a genetic disorder characterized by the growth of numerous cysts in the kidneys, often leading to kidney failure. Prior research had already suggested that higher body weight and increased visceral fat could accelerate disease progression in the early stages. This study extended that understanding by examining how being overweight or obese might affect the risk of progressing to end-stage kidney disease in both early and late-stage patients. Participants were divided into 3 groups based on their body mass index: normal weight, overweight, and obese. The findings were particularly striking in early-stage patients. Those with obesity had a significantly higher risk of reaching end-stage kidney disease compared to those with a normal body weight. Interestingly, this association was not seen in patients with more advanced stages of the disease. This suggests that early interventions focused on weight management might help slow the progression of kidney disease in this population. Shifting focus to our second study, we explore IgA nephropathy, a kidney disorder caused by deposits of the protein immunoglobulin A in the kidneys, which can lead to inflammation and, eventually, kidney failure. The study aimed to understand how albuminuria, the presence of albumin in the urine, could predict long-term kidney outcomes. Patients with varying levels of albuminuria were tracked over several years, examining their risk of experiencing major adverse kidney events, including the need for kidney replacement therapy or a significant decline in kidney function. Even among patients with relatively low levels of albuminuria, the risk of poor outcomes was notable. Those with higher levels of albuminuria faced an even greater risk. Importantly, a reduction in albuminuria, regardless of the initial level, was associated with a better prognosis. This reinforces the idea that albuminuria is not just a marker of kidney damage, but also a modifiable target for treatment. By lowering urine albumin levels, clinicians might improve long-term outcomes in patients with IgA nephropathy, emphasizing a proactive approach in managing this chronic condition. Our third study brings us into the realm of kidney transplantation, focusing on tacrolimus, a medication widely used to prevent organ rejection. The study aimed to determine if early identification of how quickly a patient metabolizes tacrolimus could predict their risk of transplant complications. Patients were categorized as fast or slow metabolizers based on how long they maintained low concentrations of tacrolimus relative to their dose. The study found that as early as 2 months post-transplant, this metabolic status was a reliable predictor of long-term outcomes. Fast metabolizers, who processed tacrolimus quickly, were more likely to experience graft loss, rejection episodes, and poor overall kidney function. These patients also showed more chronic damage in their transplanted kidneys within the first year. The study's findings suggest that this simple metabolic test could become a standard part of post-transplant care, allowing clinicians to adjust treatment plans earlier and improve the chances of a successful transplant. Together, these studies highlight critical areas where early intervention and tailored treatment strategies could make a significant difference in managing kidney disease. Whether through weight management, reducing albuminuria, or optimizing medication regimens in transplant recipients, these findings offer valuable guidance for improving outcomes in kidney patients. Stay tuned to Podocyte Talk for more insights into the latest research and clinical innovations in nephrology. We're here to keep you informed and inspired as we explore new ways to enhance kidney health and patient care.